From being a role model in COVID-19 management to a dreaded city where patients are desperately waiting for ambulances and hospital beds, Bengaluru has been caught flat-footed due to lack of coordination among government agencies and ministers. There are many reasons behind the faltering outbreak response in the city. At a time when COVID cases were spiking in other cities, Bengaluru had only 1,700 cases. But the civic agency did not learn lessons from other cities and became complacent. The lockdowns were not used effectively to ramp up health infrastructure and allied logistics. While the initial battle was fought and won by deploying men on the ground who identified potential carriers and traced their primary and secondary contacts, in recent times, BBMP brass spent more time in the war room discussing data and turning a deaf ear to frontline health personnel, while ground staff were fatigued and not much was done to motivate them. There was complete disconnect between BBMP and other government agencies on COVID containment. Further, the BBMP was not feeding real-time data and details in real time to the war room, and containment strategies got derailed. While many corporators and some city ministers found it difficult to operate given the commissioner's proximity to top political bosses, what backfired was the commissioner's move to pay a daily rental of Rs 800 per bed to private suppliers, who were given orders to provide infrastructure for the 10,100-bed COVID care centre at the Bangalore International Exhibition Centre. While the government was against any extension of lockdown as it was taking a toll on the economy, the commissioner echoed experts on extending the lockdown for another week. And lastly, there were several complaints from city MLAs stating that the commissioner was not clearing their files.